Once the need for your educational intervention has been established, you can then design how you're going to close the gap and then measure your effectiveness in closing that gap. In this Fast 5 video, we will look at how you would measure effectiveness in a program and how you align that with your educational goals and strategies. Aligning the identified need with the outcome strategy is a critical component of your overall educational design, yet it is an area where we often go astray. For example, if your goal is to change the health of a population and you measure the effectiveness of your educational intervention through a post-test, you probably have misaligned your gap with your outcome strategy. Keep this in mind as we look at outcomes measures, how we discuss them, different strategies for them, and how they need to align to your overall educational intervention.
We begin at level 1, measurement of participation. Everyone should be measuring the number of individuals who participate in an educational activity. Participation is always included, and yet is never sufficient. Too often, outcomes reports only include the number of meetings or the number of participants. Level 2 includes satisfaction, frequently called the happiness factor. Did the program address the learning objectives? Were the slides available after the program? Measuring and improving satisfaction does improve your activity. However, satisfaction alone, or measured with participation, are inadequate outcomes measurements. Let's look at level 3 outcomes, which are divided into 2 components. 3A is the declarative portion of knowledge, which is knowing what the learner should do. 3B, procedural knowledge, is demonstrating how to do it. So how might you measure 3A and 3B? Pre-post learning assessment is good for measuring knowledge. An OSCE addresses both the 3A and 3B component. If your activity addresses a declarative knowledge gap, then a pre-post test showing change in knowledge is a well-aligned outcomes assessment methodology. Level 4, competence, assesses application of learning within the educational setting. Our goal is to measure and predict future application within clinical practice. Common assessment techniques include case-based assessment and self-identified commitment to change. Reminders, feedbacks, and follow-up reinforce the application in practice. Level 5 outcomes, change in performance, translate the learning into clinical practice. Performance documents a change in procedure and the delivery of care. Common measurement strategies include data reporting from quality measures, chart pulls, and comparison to baseline performance. Self-report of clinical care is often used to document level 5 outcomes. Our goal, however, is to use an objective measure of this change in performance. Seek out data that may be collected elsewhere within your health system. Let's look at improved patient health status, or level 6 outcomes. Measuring the change in patient health requires a longitudinal assessment of intended outcomes at a patient level. This measurement is certainly more rigorous than a pre-post test. Access to patient-reported outcomes, standardized reporting registries, EHR data, or public health data can all measure change in patient health status. Consider how you will protect patient health information as well. Level 7, change in community health status, is the highest level of outcomes measurement and the most challenging to achieve. Designing level 7 outcome strategies must be developed at project inception with a clear data assessment plan. How might you assess change in community health? Measuring change in regional health status in collaboration with public health organizations is one strategy. Partnering with other community organizations is another strategy.
During this Fast 5 video, we have reviewed outcomes levels and how they can be assessed within an educational intervention. Remember that you can use multiple outcomes assessments within a single intervention depending upon the goals of your education. It is key to remember that your needs must be aligned with how you solve the problem of your educational strategy and the outcomes that you measure as part of your activity. Consider as well how you're going to share your story. Your outcomes are likely the lead line as you share the effectiveness of your education with other stakeholders in your organization. Visit Fast 5 videos for an overview of other strategies in developing your educational interventions, including the use of logic models, the ADDIE model for educational design, needs assessment, and setting reasonable goals. See these at mosaicasolutions.com. Thanks again for your attention. Look forward to seeing you in other videos.